guys, welcome back to the Skinny Truth podcast. We were trying to figure out what episode we're on, but I think we're on episode 3. And we're excited to dive into a pretty good topic today. I actually touched on this on my Instagram a couple days ago, and it got a lot of movement. And so Dr. Roller's like, let's go with that. So here we are, episode 3, and we are going to dive into how do I put it? What do you do when your primary care doctor won't help you? Which seems like such a bizarre, like, why do we even have to ask that question? You know?
It's a crazy thing to ask, isn't it?
Yes. Like, why do we? Yeah, it's crazy. So, we're going to dive into that today. But as always, thank you guys for listening, liking, subscribing, and enjoying as much as we do. We love doing this. And here we go. Let's dive into this today.
Well, I think the first thing to understand is just how prevalent obesity and overweight is. And so it's like 2/3 of the country at this point.
It's crazy.
So it is something that every medical provider sees every day. And it doesn't matter what specialty you're in.
Right.
You know, if you're an orthopedic surgeon, a spine surgeon, if you are a pulmonologist, a cardiologist, an endocrinologist, family practice, internal medicine, pediatrics, like we're seeing it.
Yes.
Like, it's
across
everywhere.
the board. Yeah.
And so you would think that it would be one of these things that is a hot topic of discussion, the first thing you would bring up, right?
Right.
Because what are the side effects of obesity? Well, the list is, what, 1,000,000 miles long?
Right. I mean, you would say that most of the reasons that people go to the doctor, probably if they are obese, stem from their obesity. Would you venture to say that?
Oh, yeah. So
yeah.
High blood pressure.
Right.
Diabetes. Back pain. Joint pain. Reflux.
Yep.
Sleep apnea, which a lot of people think sleep apnea is snoring.
Yeah.
And it's a symptom of it, but sleep apnea causes heart attacks, heart failure, and stroke. So untreated sleep apnea is horrible. You get a fatty liver disease. You get into migraines, and then the C word, cancer.
Yeah.
I mean, it's there. And for women, it can be infertility. It can be irregular menstrual bleeding, leading to endometrial cancer and those things. So it's like the root of all that is happening.
Right.
But how many times do you go to the doctor and they don't mention obesity, and it's a medicine for this, a medicine for this, a medicine for this.
Let's treat everything else. Yeah. And, I've been surprised at the messages that I get from people saying, how do I approach this? What do I do? I've gone to my doctor. They don't want to, I don't know, they were interested in GLP-1s. They won't do that, or they won't send me to a bariatric surgeon. What do I do? And it's a really hard spot for patients because not everyone is super educated in how the health system works and what they can and can't do.
Yeah, it's kind of like me trying to argue with my physics professor in college about physics.
Yeah.
You almost feel like no matter what, you're never going to win because you don't have that knowledge base. Right. However, I will say that the bariatric patient or the obese patient is different than me in physics because they know what they're living through daily.
Right. Yeah.
They may not be able to tell you the medical terms, but they can absolutely tell you how it impacts their lives.
Right.
From the moment they get up to the moment they go to sleep, and then probably even the dreams they have at night.
Yep.
That's all.
Every part related. Of your life is affected. Yes.
Probably the biggest insight for me into this was, I'd probably been practicing for, 3 or 4 years, but I was working with a trainer, and it was just 30 minutes. And it was kind of like the HIIT kind of high intensity interval training, cardio stuff. But he had me put a 40-pound weight vest on. And we did that 2 days in a row. And I can tell you, I have never been that sore in my life from doing things that jumping jacks, push-ups, burpees, things that I would normally do.
Right.
And it was like, how does somebody do this at 150 pounds overweight?
Right. It's funny you say that because I have a weighted vest and mine is only 10 pounds and I notice a difference. And I carried 270 extra pounds on my body. And
Okay,
it's
so
just,
if 1 pound of pressure equals, or one
was
pound
it
equals 4 pounds
4 pounds?
of pressure,
Yeah.
your legs at 270 pounds, we're seeing 1,080 pounds of pressure.
It's insane. And I'm so small. Like I'm 5 foot tall. So
Yeah.
it's just no wonder I could hardly do anything.
So why, and this is so I will say the history of bariatric surgery started off not great. Okay.
Mm-hmm.
And this is back in the mid to late 90s.
Mm-hmm.
A lot of people I mean, it was all done open at that point, where, big cut from top to bottom.
Right. Huge recoveries.
Huge recovery. They're in the hospital a week if things went well, and they didn't. Patient selection wasn't great,
Mm-hmm.
and we are talking obesity it's a sickly disease, and so
Mm-hmm.
it's high risk. I was high risk, and so even compared to like somebody who's completely healthy.
Mm-hmm. Right. Yeah.
So, and that would be true if you're doing heart surgery or spine surgery or knee surgery or hip. I mean, it's just a risk factor. The physiologic changes behind getting opened up. So anyway, a lot of people did bad. So
Mm-hmm.
it got a very bad name. So then laparoscopic surgery came about, and it was a game changer
Mm-hmm.
that you could do these tiny little incisions and patients could go home in 2 days, and
Right.
then one day, and now same day.
Same day. Yeah.
So that was a big change. And early on, the doctors, like my dad's a primary care doctor in Tulsa, he
Mm-hmm.
he remembers those days.
Right.
Okay.
And so they probably were nervous to send
Right.
apprehensive to send their patients for that.
They definitely were, because you had to weigh risk benefits. And
Right.
we all know obesity is going to kill you. I mean, there is no
Mm-hmm.
doubt that it,
Yes.
it will happen at some point, or it will cause the thing that causes it. Heart attacks, diabetes, strokes, cancer, no doubt. But and
Right.
it's the second leading cause of preventable death. It's right behind smoking, and you got to also come from it if you're a primary care field of it kills more people than alcohol, smoking, and poverty. So
Mm-hmm.
it's really deadly. But that was the older generation. So now we
Right.
are in 2024.
Mm-hmm.
25 years later,
Yeah.
and
So much advancement and yeah.
training and patient selection and optimization of the patients after surgery, and our enhanced recovery after surgery protocols. We call them ERAS. And so,
Mm-hmm.
like for us, we inject this long acting numbing medicine into the muscle so their muscles
Mm-hmm.
don't hurt, so they can take better breaths, they can walk better. All these things
Right.
enhances the recovery. So significantly different. So this generation of
Mm-hmm.
doctors, they don't remember that.
Right. Right.
Our outcomes in surgery are equivalent, complication wise, to gallbladder surgery.
Yeah.
And so, and I get PA students all the time that rotate with us. And I always ask them, how many patients did you send for weight loss surgery last month on your
Mm-hmm.
internal medicine rotation? And deer in the
They're like,
headlights look, none.
none. Yeah.
I go, well, how many patients do you think you saw with a BMI of over 35?
Yeah.
Almost all of them. I go, okay,
So
did you see any knee pain or back pain?
mm-hmm.
Well, yeah. Did you send them to an orthopedic surgeon? Well, yeah. What do you think the cause of their knee and back
Right.
pain were? And it's at that moment you can see the student
Right.
who's learning and training connect
Mm-hmm.
the dots.
Yes.
Why did we do that?
Right. Why
But they're
aren't we
being
taking
right.
care of the first problem? And you mentioned smoking being the leading cause. And I mean, I've never smoked. I'm not a smoker, but I can guarantee you almost every primary care doctor, if they have a patient that smokes, they're like, stop smoking.
That's
And
right.
I would even venture to say that they offer like medications to help them quit smoking and to treat that. However, as an obese patient that I was, when I went to the doctor, I can honestly say not one single doctor ever mentioned bariatric surgery to me. Never. It
Did
was
they
diet and exercise.
Okay, so they would ask you about your weight. How did they ask you?
Briefly. It was like a very around the bush kind of conversation. It
Right.
was just like, you really need to work on diet and exercise. You really need to lose some weight, diet and exercise. And that was like pretty much the extent of it. It wasn't
Did Okay, so here's a great point for the people out there that are having this issue. Well, number one, you do not need a referral to
mhm.
come see the weight loss surgeon or bariatric surgeon. You do not need it. We can get that after the fact if your insurance requires it. or find you a doctor that will support that. But
Right.
what if you had asked, so they said, okay, you need to diet, you need to exercise, you got to get your weight off. And what if you just said, well, take someone in my situation, how effective is that?
Mm-hmm.
I wonder what answer they would have given you, because
Yeah.
the answer is less than 1%.
Right. Yeah. It's not going to work.
So if you flip it around, take another disease, high blood pressure, and they put
Mm-hmm.
you on a medicine, and you go, well, how effective is this medicine? And they said, uh, it works less than 1% of the time.
Yeah.
You go, I don't want that
Right.
medicine then.
Exactly. But in talking about high blood pressure, I had high blood pressure and I would go to the doctor and my blood pressure still wasn't controlled. And what did they do? They upped my blood pressure medication. They added a blood pressure medication. They covered up
Yeah.
the issue. I mean, I guess you're treating the issue, but you're not curing the issue. Like
You're
if
not
I would
getting
have
to the
lost
root
the
cause.
weight,
Right.
exactly. Yeah.
So did he or she ever bring up weight loss surgery to you?
Never. And my primary care doctor, I can say, is excellent. Like, I honestly love my doctor, but never did they bring it up. And why do you think that is? Like, why is this happening? Why aren't we having more blunt conversations about you need to lose weight and these are your options to do this? And
So I have a few opinions. Some are slightly jaded. I'll
yeah,
get that, but it's only because I've been told that, and I would have never
right,
thought it. But you got to think about this. How many times do healthy people go to the doctor?
right. Not a lot.
Okay.
Mhm.
I was just talking with my wife, and I said, "How many times have you been to that?" I mean, she's a doctor, but
Yeah.
still, she should go to a doctor. She hasn't
Yeah.
been to a doctor in 5 years.
Yeah.
It's like, but there's not an issue that she needs to see. Whereas
Yeah.
a diabetic patient would go 4 times a year.
Yep.
Hypertensive patient would go 4 times a year.
Mhm.
So I actually was at Whole Foods. This is when I kind of, maybe an epiphany, maybe eyes being open. A Sunday ran into a primary care provider who said, "Oh, I saw these two patients. They're doing awesome. If you keep that up, you're going to put me out of business." Ha ha ha.
Mhm.
And he was laughing. And
But there's some truth behind that.
that has never gone away out of my head. And I never
Mhm.
asked him exactly what he meant, but I see too many patients. Every single pre-op I do, I ask them who their doctor is, how long they've seen them, and do they support you doing this? And the most often the answer is, "Oh yeah, yeah, they support it." And then
Mhm.
if I go, "Who brought it up?
Mhm.
Did you bring it up, or did they bring it up?" And oh, well, I brought it up. And they said, "Oh yeah, you're a great surgeon. Go to him." Like, I go, okay, how do we get over this hump where they bring it up the way they would for any other medical problem? I mean,
Right.
the stigma we talk about of having weight loss surgery, it's permanent. It's all in medicine
Yeah.
too.
Right.
Doctors
Yes.
have it.
Mhm.
And I think there's also another caveat that they don't want to hurt patients' feelings.
Mhm. Yeah.
And for years, we've done primary care education and taught to them. And I, especially with students, I'm like, okay, you need to be respectful, but at the same time, you're a provider, and patients are
Mhm.
looking to you for help.
Right.
And you can't ignore a life threatening medical condition.
Correct.
And that's how I see obesity. It's a life threatening
It
medical
is.
condition. So if they're sitting there in very much the same way, we talked about it last night. If you're in the office seeing somebody for high blood pressure or diabetes, but you see what you think is a skin cancer right here, maybe it's a
Right.
melanoma, something scary, you would obviously bring it up.
Right. Yeah.
So by the same token, if you're looking at somebody who's 350 pounds, you have to bring it up
You right.
and say, okay, this is an issue. We need to deal with it.
Mhm.
So the question is, what are the treatment options? And that's what we do in surgery. We talk about the risks of surgery, we talk about the benefits to surgery, and talk about alternatives to surgery or
Right.
alternative procedures. It's
Yes.
called informed consent. Those are the things you
Mhm.
touch on. So treatment options, diet and exercise, medicines, weight loss surgery.
Mhm.
This really never gets presented unless the patient brings it up.
Correct. Yep.
And it's really, despite seeing tons of patients that have done great. And so,
Mhm.
I'd be curious. You've probably seen your doctor since.
Mhm.
You are a walking billboard of success.
Mhm. Right.
How do you think that has influenced on your doctor
uh,
and if he sends
referring.
patients? Yeah.
I don't know. I should ask him and just say, I mean, because he
Yeah.
always is like, I mean, applauds me, every time he sees me, like, oh my gosh. I mean, I'm just a totally different person. I mean, physically, but like, I have no diagnoses anymore. It's
But
just,
how would he not send everybody after that?
right.
How
But
could you not move the needle?
do we want, does our health, I hate to say this, but does our healthcare system want to keep people sick? It continues to bring money in. It's, it's sad. But that is what I feel like is the bigger issue here.
I had an orthopedic surgeon years ago when I was, young and dumb, new surgeon starting. And I had a busy day that day, which was great. I love working.
Mm-hmm.
But the comment was, hey, you need to slow down a little bit. We need knees to replace.
Mm.
Now, there are some very reputable orthopedic surgeons, spine surgeons,
Mm-hmm.
who do the right thing because half of all spine surgery can be avoided with significant weight loss.
Mm-hmm.
A lot of knee surgeries can be avoided or downgraded. Okay, maybe you don't need a
Mm-hmm.
replacement, but the idea
I mean, how
of
many people with knee surgery? I mean, I know they're like, we won't operate on you until you lose X amount of weight.
well, so that really depends. There are now insurances that won't cover complications from knee
Oh.
surgeries. And so, if and the two biggest risk factors for like knee replacement surgery are your BMI over 35 or 40 and higher,
Mm-hmm.
and a hemoglobin A1C over 8, so diabetes.
Oh, yeah, right.
So, uncontrolled
Poor
diabetes,
wound
or
healing.
yeah, and you get joint infections and hardware
Mm-hmm.
infections, that kind of thing. So, they will send. And this isn't all people, but I mean, it's still the number of people that come into us that have already had knee replacements.
Mm.
Because this idea of, well, your knees hurt because of your weight, and so
Yeah,
we'll replace your knees so you can start exercising more. Well, we
yeah,
already know that diet and exercise, when your BMI is over 35, works less than 1% of the time. So the logic it's not there.
right. Yeah.
And the thing about obesity and surgery is that it impacts every type of surgery. I mean,
Mm-hmm.
there's not and it makes regular, sometimes very simple surgeries like gallbladders really hard. Liver's
Mm-hmm.
so big you can't lift it up. Visualization is hard. The abdominal wall is super thick. You can't move your instruments.
Mm-hmm.
Same with backs. And so, the guy who did my back surgery 10 years ago won't operate on people that are big. You have to lose the weight. And that's where weight
Yeah.
loss surgery comes in. Your knees hurt, your back hurt, your hip hurt. So how are you supposed to exercise to lose the weight so you
Right.
can get the surgery so your knees, hips, and back don't hurt?
Right.
That's where weight loss surgery comes in, but they won't talk about it. And so
Yeah.
unless the patient brings it up, then they're supportive. And so
Mm-hmm.
I've said this for years that I think our patients are the smartest ones out there. On
Mm-hmm.
average, they've researched it for about 3 years or more,
I remember you
and they
saying that.
know it's like if you have high blood pressure and you take a medicine, you don't necessarily feel high blood pressure
Right.
impacting you, right?
Yeah. Yeah.
You know, but you
But
feel
the
your obesity.
obesity, yeah, every second of every day.
And just look at all the diabetics out there. We have an 85 to 95% cure rate, depending on what surgery we do, of
Mm-hmm.
diabetes.
Right.
Now, another thing, so why would you want your patient to continue to have diabetes instead of the chance of getting rid of it?
Right.
Because the risk of surgery, same as a gallbladder, and nobody has a problem sending somebody to have a gallbladder surgery.
Yeah, exactly. Yeah.
And this is just kind of what I've seen over 17 years is we
Mm-hmm.
move the needle from it's not dangerous, and if patients bring it up, they'll do it, but we're not getting to the point where you need to do this because your life is at risk.
Right. Yes.
So now another sometimes issue that we'll have some healthy academic discussions over is when one of them will say, "Yeah, but they all regain their weight."
Mm.
You're like, "Well, what percentage do you think that is?" Like, well, at least half. Well, that's
Mm-hmm.
not true,
Mm-hmm.
but I think it could be around 10 to 15%. I think that's
Mm-hmm.
accurate. But again, this is a tool, and is it the surgery's fault if a patient gains their weight back? No. I mean, now
No.
this is excluding if you had a bad surgery or
Right.
wrong surgery,
Depending on
stuff like that.
surgery and
Right.
yeah.
So it could
Assuming
be
everything went how it should go
right.
and you had the correct surgery.
then it's not that high. But let's just say it
Right.
was 50%. Just for
Mm-hmm.
example,
Mm-hmm.
if you assume that, that still means that 1 out of 2 have their diabetes go away and they kept their weight off.
Right.
So, and we know the risks are really low. So why is that still not successful? Because how many patients get surgery for, let's say, their back surgery, where
Mm-hmm.
there's like a 90% chance their back pain's not going away?
Yeah.
Or cancer. How many patients get surgeries for stage 3 and 4 cancer, or stage 4 cancer, where
Yeah.
they're at 5 years, there's only a 5% chance they'll be alive.
Right. Yeah.
Well, you're willing to take that 5% chance on them. Why?
But not
Because
for
it's cancer and
bariatric
they want to live.
surgery.
Right. So even if you believed in the 50%, which is not true,
Mm-hmm.
then it's still better than 5%. And so you have no problem sending to the cancer doctor for a surgery that has a 5% survival at 5 years.
Mm-hmm.
But obesity is the second leading cause of preventable death. It's
Right.
responsible for 20% of the deaths in the country, and you're not. And so then you get
Makes no
into, well,
sense.
it is frustrating. It is very, and
Do
so
you,
as a patient, I would be too.
so I have a question. Do you think these issues are going on in other countries like it is here? I mean, do you think I feel like other countries will they're more preventative. Like let's prevent these things from happening whereas
So
we treat sickness.
I do think there is a focus on prevention. So, for instance, just like in the foods, I was watching something this morning on
Yes.
Twitter of the what is allowed in the UK versus the US, and I think
Yes.
those are great things. They still have an obesity problem over there. They still
Mhm.
there. I think if I were to make a comment, their issue is not so much of we don't like weight loss surgery; it's their access to care. When you have
Yeah.
nationalized medicine or socialized medicine,
Right.
it could be 2 or 3 years before you can
Yeah.
get a surgery.
Yeah.
So that's why I think their surgery volumes are low. I mean, here 1% of eligible patients are getting surgery, and so we do have some insurance issues that we deal with here. But in general, it's like if we got everybody on board.
Mhm.
So then you get into now we have these injectable drugs that doctors are offering, and people
Mhm.
who don't really work in weight loss have never worked in weight loss, but all of a sudden
Mhm.
it's like, oh, you have obesity, and we're seeing more of a talk of, hey, because they'll come. Everybody that we see now, everybody has been on them.
That's what you said. Everybody's
Yeah,
tried them.
yeah. I mean, either it didn't work, or there's side effects, or it cost too much, or they couldn't get it, or they decided I don't want to
Mhm.
be on a medicine forever.
Right.
Or an expense is the number one. So, but they're having the conversation a little bit more now, and then putting them on
Mhm.
medicines, but they're not having the complete conversation around what is it. So, for instance, you have high blood pressure, right?
Mhm.
Did they ever say to you, okay, you're going to be on this medicine for 4.5 years or six
No.
months? Did they ever tell you when it was coming off?
Nope. Nope.
The expectation was you're on it
For
forever, right?
life. Right. Yeah.
Well, most people don't think of weight loss medicines as something that you're going to
Mhm.
be on forever.
Right. They think they're going to lose the weight and come off of it.
Right. But these medicines are intended for a
Mhm.
chronic disease,
Mhm.
and they're intended to be used forever because if you
Mhm.
stop, the weight comes back.
I mean,
So,
it's your tool, just like bariatric surgery is your tool, but
right.
that tool never goes away.
And that tool is very expensive,
Right.
and that tool has side effects and long term effects we still don't know. But why now is everybody willing to put their patients on a GLP-1
Mhm.
without talking about, okay, here's our plan. Here, we're going
Right.
to put you on this medicine and you're going to stay on it forever. Because that's the other question I always ask who your doctor is or your provider, who's supportive, not supportive. Okay, you were on this medicine. Tell me how that conversation went when you started it.
Mhm.
Well, just this will help me lose weight. Did they discuss how long you were going to be on it? No. They discuss side effects? No. Did they discuss like what my 6 month, 1 year, 5 year plan is with regards to this medicine, or even
Mhm.
how much this is? What if your insurance? And so we're looking at like $500 to $1,200 a month.
Jeez.
So that adds up pretty quickly, and so
Yeah.
we see a lot of patients who come off of it because like I can't keep doing this.
Right.
So then let's say you spend $1,000 a month for 2 years, so 24,000 on the medicines,
Mhm.
and you're like, I can't do this anymore. And this is for like 15 to 20% of your weight.
Mhm.
So someone at 400 pounds, that would be at 20%, that would be 80 pounds. So you went from
Mm-hmm.
400 to 320, which is still morbidly obese,
Yeah.
and you're now down $24,000. And then you go, I just can't keep affording this.
Mm-hmm.
So you stop. And
Right.
guess what happens?
It's all back.
It's all back. So now you
Mm-hmm.
go, where did my $24,000 go?
Mm-hmm.
And that's the
And you could have had bariatric surgery.
for less than that.
Yeah.
Um, Now, can your weight come back after a bariatric surgery? Yes, if you decide to make poor food choices and not move your
Mm-hmm.
body and not take your vitamins, supplements, basically just not do the right stuff.
Right.
But
Yeah.
it is a discussion that is not being had yet. It is being passed out almost like Halloween candy.
Right. Yeah.
And I've seen 3 people just in the past couple of months that have had actual emergency surgery for bowel obstructions, or was thought to be a bowel
Wow.
obstruction from the medicines. So that's why
Mm-hmm.
they came in as like, listen, my doctor said I can't take this anymore, and
Mm-hmm.
I don't want to be diabetic.
Yeah.
And so
And
I mean,
that's
these
the
are
thing though, too. If you're diabetic though, even on these GLP-1s, it's not reversing your
mm-mm,
diabetes. It's treating it,
right. It's lowering
but
your
you
blood
still
sugars.
have it. Yeah.
Yeah. Yeah. And so I guess my question has always been, why is it better to be on a medicine and control your blood sugars than just get rid of diabetes altogether and not
Yeah.
be on any medicine?
Right. Yeah.
And patients, if given the choice, they'll always choose, well, get rid of it.
For sure. Yeah.
But we don't, I mean,
They
it's
don't
not
know.
like,
Yeah.
and it should be first line therapy. Weight loss surgery is the most effective treatment against type 2 diabetes that we have. It is, if your
And
BMI is over,
obesity, I mean, technically, I mean, too, right?
oh, absolutely. It's the by
Yeah.
far. So, whereas the medicine will do 15 to 20%, we're, like with the duodenal switch surgery, 45 to 50%.
Yeah. Right.
Or more. I mean, so if you're
Mm-hmm.
400 pounds, we can get you down to, depending on your height, 180, 200.
Mm-hmm.
And we've done patients that were 630 pounds, and, they've lost over 400. So you gotta, as a patient, you need to advocate for yourself. And here's all these facts that we've gone over today that you can take back to your doctor and say, what about this? What about my diabetes? What if I want to come
Mm-hmm.
off high blood pressure medicines? How do I get off of them?
Mm-hmm.
I can't exercise because I
Right.
hurt. And
Mm-hmm.
and there's a high risk of hurting yourself exercising with the extra
For
weight.
sure. Yeah.
Tweaking a knee or an ankle or a back. And like, I want to come off the medicines. I want to
Mm-hmm.
feel better. How do I do that? And no, I don't want to inject my body with a medicine every
Right.
week for eternity.
Right.
What are my options? And so you kind of get them into a corner like, well, there is weight loss surgery. And
Mm-hmm.
listen, I don't expect, our primary care doctors are probably overburdened with
Mm-hmm.
the amount of stuff they have to do. And medicine is
Right.
I think the burnout rate's high, and they're trying to take care of every single issue that you have. And so I think it is our healthcare system that's gotten them into that position. And
Mm-hmm.
so I think they'll respond well to just, yeah, this is a good idea. But, in the same instance, when you say, well, but what surgery should I get? You
Mm-hmm.
can't expect them to know all the pros and cons of each of those surgeries. In the same
Right.
way, if you came to me and you said, well, my cardiologist says I need stents, but, what kind of stents do you think I should get?
Right. You're not an expert in that area.
I don't do cardiology.
Right. Yeah.
Or, hey, my kid has got this runny nose and a fever. I'm like, well,
Right. Why are you
I
coming to
forgot that
me?
part of
Yeah,
medicine.
exactly.
It's not what
Yeah.
I do. I talk to somebody. So I think that all we really need, and all you need from a primary care doc, is, listen, obesity is dangerous. It's a very
Mm-hmm.
real medical issue, and you need treatment.
Mm-hmm.
And I think our patients are going and saying that. And I think once you get to the point where you bring it up,
Yeah.
there's a lot of compliance there and it gets done.
Yeah, for sure.
But the number one thing is, you need to be the one. Don't wait on them to bring it up.
Right, right. Because it probably never will get brought up.
Right.
Yeah.
Be proactive
Yeah.
and make it happen the way you did. I mean,
Yeah.
that's the thing. And look where it got you. And so
Right.
if you hadn't brought it up, so you're 3 years out now.
Mm-hmm.
If you had never brought it up, do you think you would be here?
No. Somebody asked me that the other day. They said, how much do you think you would weigh now if you hadn't had surgery? And I just can't even imagine. And I know by this point I would be dealing with other diabetes. I mean, other issues. I was a lucky one. I just had high blood pressure. But if I was headed down that same road, I mean, I would be so sick.
Well, and so that's the question for people out there is, you know, be proactive.
Mhm.
There is no time like the present, but,
Right.
and it's okay. I love it when patients ask me hard questions.
Mhm. Yeah.
Because I want to show them I'm knowledgeable about the answers and why we're doing what we're doing. And I think it
Right.
is very fair to ask. For like when I had my back surgery and I saw four different spine surgeons and I got four different answers, I was
Mhm.
asking lots of questions.
Mhm.
And eventually I went with a guy that I felt the best about, and it was the bigger of the surgeries. And I'm
Mhm.
like, I can't believe I'm going with the guy the bigger the surgeries, but the results seemed like they were going to be the
The
results I wanted,
best. Right. Yeah.
long term.
Mhm.
And he did a great job. I was actually a spine surgeon in Tulsa, Dr. Clark. He was a
Oh,
great,
yeah.
great surgeon. And we were med school roommates. And I'm like, I can't believe I'm
Oh,
going to let my
cool.
med school roommate operate
Right.
on me.
Yeah.
I know
How
exactly what you
crazy.
did. I
Yeah.
know what we were up to.
You're right. Yeah. I know what you
So
did in school.
that's right. We know he's a fabulous surgeon. So that's, I mean, it's very similar when you talk about those things. So why do they not refer? I think we're still working on it, but it's something
Yeah.
we've been working on as bariatric surgeons for me 17 years, and we're not necessarily moving the needle. So that's why we try to get the
Mhm.
message out
Yep.
directly to the patient.
Yep.
And you've been such a amazing mouthpiece for bariatric surgery and basically just shining a light on
Mhm.
this can be you. This
Right.
can be you.
Yeah.
And I mean, I
I'm
can't even
no
tell you
one
how many
special.
people.
That's what
Yeah,
I say. Like, if I can do it, you guys, I'm telling you, anyone can do it. And you just have to have the want to change your life. That's it. You have to want to change your life, and the rest is history.
yeah,
So,
I agree.
yep.
I totally
But
agree.
if you are struggling to get to a bariatric surgeon, just call. Call Dr. Roller. I mean, he's the best. I coming from me. But find a bariatric surgeon that you trust and that you're interested in that does all three surgeries, and call him up yourself. If you cannot get anywhere with your primary care doctor.
Yeah, just don't take no for an answer. I mean, that's
Yep.
the bottom line. That's been my ever since I was a resident and then into practice. Okay, the hospital is telling you no. The
Mm-hmm.
lab is telling you no. It's like no. The answer is not no.
Yep.
It's how are we going to get it done?
Right.
Tell
Yep.
me,
Find a
tell
way.
me how it's going to happen, not that it can't happen.
Right.
And you have to be an advocate for yourself. Just because your doctor doesn't bring it up, your provider doesn't bring it up, press it on them.
Mm-hmm.
Ask the questions. Diet exercise isn't working. What can I do? And they'll
Right.
get there. They'll get there. And the more people like you that are out there and outspoken about it,
Mm-hmm.
the better it is for everyone. Because we got to get everyone back from being chronically sick. I saw
Yeah.
this thing that RFK Jr. was talking about, and
You
not being
watched the
political,
same
but
thing I did a
yeah,
couple days ago, the thing they had at Washington.
yeah. I mean, so like
Yeah.
60% of our country is dealing with a chronic health condition, where 30 or 40 years ago was 5%.
Yeah. Did you see the? I don't remember what the statistic was about fatty liver, though. How that used to be a disease of like 50 plus, and now we're seeing it in like kids,
In
fatty
kids,
liver disease. Yeah.
which a lot of people think that's kind of a benign, oh, fat in my liver. No, it leads to cirrhosis.
Right.
And
Yeah.
cirrhosis, the only treatment for cirrhosis is a
Transplant.
liver transplant,
Right.
which is like a huge surgery,
Yeah. Yeah.
life altering surgery. So,
It's.
that is how I would advocate if I was a patient. And I know it's hard because I've been doing this for a long time and I know the questions
Mm-hmm.
to ask. But now you know that you know the questions, you know the statistics, and if at the end of the day, come to us, we'll get it done for you. But
Mm-hmm.
advocate for yourself just the way Laura did. That's all I
Yep.
would say. Is that is the most important thing. And next time you see your doctor, ask him how many referrals he sent to weight loss surgery since you.
I'm going to. Yeah. I'll see
You
what he
want to
says.
take a bet and see what do you think the over under is?
It's not. I bet it's not. I mean, like I said, I'm not dogging him because he is an excellent provider, but I
Correct.
bet it's not. Yeah,
Do you think it's
but also, I don't like to say this either, too. But I don't know that the program that is here in Tulsa produces the same like.
Okay, so
You,
there can be local biases, and that is
right.
100% true.
Yeah,
There's a lot of complications in our area, but that doesn't mean keep a patient sick.
I know. Yeah.
And because people travel all the time. I mean, just think about it. People go to MD Anderson,
Mm-hmm.
they have to travel,
Yeah, if
and
you have
doctors send there.
cancer or
I send
right.
patients there. Like
Yeah.
if they come in with a big pancreatic cancer, they're going down there, or Mayo
Yeah.
Clinic, or so there are.
People
Again,
travel all the time.
yeah. So depending on disease process, people seem not to have an issue to send their patients away.
Right. Yeah.
So that may be a thing, but I'll say 10. Do you think it's over?
And the
I'm gonna
last how long?
Since you've had surgery, 3 years.
Since I've had, you think 10?
I think less than 10.
Less than 10. That's probably pretty on tune, I
Do
would
you
think.
do you want to take the over 10? And what are we betting on?
No, I say under. There's no way over. And it's really sad though. I mean,
So
just
ask
as
him.
someone, I will.
Yeah.
I'll ask him. I'm actually going in the next couple weeks, so I'll ask him.
That'll be a great question, and then see if you can get him on tape. No,
Yeah,
don't do that. Don't do that.
I'll have it
No, but
secretly recording on my phone.
I think it'll give you some excellent insight.
Yeah.
And
He follows me on Instagram. My doctor follows me. So, and he talks about like how proud he is for me sharing my story and stuff. So it would be interesting to see what he's referred out.
Yeah, and maybe hopefully
maybe he'll surprise us.
Yeah, hopefully I'm dead wrong, and
yeah,
that would make my year. Yeah, it's one of those things where it's like I'm happy to be wrong.
Right. Yeah, for sure.
So
yeah.
Awesome. Well, guys, this has been a fun one. This is something that I know Laura gets messaged about a ton. It is something that I hear in my office a ton. Mm-hmm. So thank you for joining us. It's a controversial topic. I'm sure I might get some heat on it, but that's okay. It wouldn't be anything different. As always, follow us, subscribe, comment, or on YouTube, Spotify, and the podcast channel. We appreciate you tuning in and supporting this podcast.
Yeah. Thanks, guys. And we'll see you next time.